Good morning, good afternoon, and a warm welcome to our channelists here this morning in Manila and those of you joining online. Thank you for joining us for this press conference. Today we are here to launch a new report looking at how the Western Pacific is tracking on the health-related sustainable development goals and to preview the expected outcomes of the WHO Regional Committee meeting for the Western Pacific taking place here next week. This will be my first regional committee meeting since taking up the role of regional director in February. It is both a privilege and a great responsibility to lead WHO's work in this vast and dynamic region. I'm looking forward to having important dialogues with ministers, senior officials, and partners on key health challenges and how we can work together to address them. But first, let me share a few highlights of the report I mentioned. As you may know, the world leaders came together at the UN in 2015 and agreed on a set of global goals to be achieved by 2030. Among them are targets to improve health and well-being. The report we are releasing today looks at how countries in this region are tracking. It finds that there has been some impressive progress, but also points to a number of areas where urgent action is needed to meet the goals by the deadline, just 6 years from now. In terms of life expectancy, the report shows that COVID-19 did less damage in the Western Pacific than other parts of the world. Life expectancy is now 77 years, longer than any other region of the world. But it's not all positive. The pandemic, of course, caused devastating losses of loved ones, and it disrupted progress in various other areas of health. It also deepened inequalities. The report points to major challenges in the region in terms of climate and environment-related health concerns, planning for rapid population aging, tackling non-communicable diseases like heart disease, stroke, diabetes, and cancer, and ensuring people can access the health services they need where and when they need them without any financial hardship. We urgently need transformative primary health care, robust systems for health financing to achieve universal health coverage and the SDGs, as well as digital health, climate-resilient health facilities, and many more. And this brings me to the business of the regional committee meeting taking place here next week. It is WHO's most important governing body in the region. Once a year, health ministers and other senior officials come together to decide on key priorities. In my main address, I will share an update on WHO's recent work in the region. Then I will present a new vision for improving health and well-being over the coming 5 years. The vision centers on the analogy of weaving a mat, a traditional activity across Asia and the Pacific. It symbolizes the collaborative efforts needed by WHO, governments, and partners across 5 vertical and 3 horizontal strands during the period 2025-2029. The vertical strands of action, led by government working with WHO and other stakeholders, are focused on transformative primary health care for universal health coverage, climate-resilient health systems, resilient communities, societies, and systems for health security, healthier people throughout the life course, and technology and innovation for future health equity. The horizontal strands of action by WHO are to ensure that our country offices are equipped with skills for scaling up and innovation. There are nimble support teams in the regional office, and we use communication effectively for public health. Also, at the regional committee meeting, member states will consider action framework to address two important health challenges. First is a regional action framework for health financing to achieve universal health coverage and sustainable development in the Western Pacific. Despite recent reforms, we don't yet have the policies and public health financing needed to ensure equitable access to essential services in the region. Many families are struggling to pay for medicine and doctor's visits, and they are falling into poverty. In 2019 alone, more than 300 million people in the Western Pacific faced catastrophic health costs. To achieve universal health coverage and sustainable development, we need more government spending on public health, prioritizing primary health care. The draft framework that member states will consider next week aims to help them improve health financing by ensuring greater reliance on public funding for health, more equitable and efficient health spending, financing primary health care now and into the future, strengthening governance for health financing, and promoting health for all in economic and social policy. Member states will also consider a regional action framework on digital health in the Western Pacific. As the use of digital technology to improve health continues to grow rapidly in our region, the need for better governance and legislation, standards, and workforce capacity are becoming more important. The draft framework that member states will consider focus on 5 areas: governance, socio-technical infrastructure, financing and economics, digital health solution, and data. In addition to the regional action frameworks I have described, delegates will engage in panel discussions on climate-resilient healthcare facilities, transformative primary healthcare, and oral health. In addition, they will review progress on issues such as health security, including antimicrobial resistance, non-communicable diseases and aging, climate change, environment and health, and reaching the unreached. There will be a special event on the first ever WHO investment round, where we expect governments and partners to pledge new support for our work to improve health in the region. There will be side events on topics including oral health and tobacco control. In another phase, we will unveil a series of 6 exhibitions showcasing important health issues facing our region. And these include the future of health, strengthening health emergency response capacities, climate resilience and environmentally sustainable healthcare facilities, the dangers of new and emerging tobacco and nicotine products, health equity, and reaching the unreached. As you have heard, there's a full agenda next week, but I want to ensure that we have enough time for questions and answers. And as you can see this morning, I'm joined here today by our directors of our technical division in front of us, as well as the WHO representative to the Philippines. They are here to answer any questions health-related in our region. And I thank you for joining us this morning, and we would be happy to take your questions now. Thank you.